Good afternoon, everyone. This is John Phillips, the interventional cardiologist in Columbus. So this is our second episode of Save My Piggies, a podcast dedicated to patients with peripheral arterial disease. These are inspirational stories and stories of perseverance. And our guests today are Derrick and Toni from Chicago area, correct?
Yeah, just outside of Chicago. Yep.
Fantastic. And you guys have a story about peripheral arterial disease and perseverance and really working hard to save your legs. So go ahead and Derrick and Toni, tell me your story today, please.
You want to start?
Well, it started in 2018 in May. He was having some cramping in his legs, and I kept spraying magnesium oil and giving him all these, different vitamins, thinking, well, it's just muscle cramps, it's just muscle cramps. And finally, one day, we were coming home and his leg was cramping so bad that he literally fell out of the car in the driveway.
Opened the door, went to step out, and went straight to the ground.
And so I ran in the house and I got some more magnesium, thinking, okay, what is really going on here? And being diabetic, he found out that he had a small wound on his pinky toe that he didn't know what was going on. And so he went immediately to the podiatrist, and then this big nightmare started. They put him in the ER, and all of a sudden we were with vascular surgeons and they were amputating toes. They started to amputate toes.
Without even saying anything about P.A.D. Never even heard of it until, was it about a year after the first year?
Yeah, we didn't really know. They never really diagnosed it with P.A.D. They just said that he had some blockages, and being diabetic, this is what happens when you're diabetic. And they really kind of filtered us more towards the podiatry end of it, and also with wound care. So the vascular surgeon we had was not very good at unblocking arteries below the knee. We didn't even understand what was happening. They did unblock an artery from the groin to the knee.
Yeah, put a stent in on that side in the thigh area.
And we didn't realize that what was actually happening was a blood flow issue.
So prior to you having that intense pain or falling out of the car, did you have issues walking, cramping with ambulation, or not really?
Not until that I had some cramping in the hamstring area and a little bit in the calf, and I really didn't think much of it other than muscles and everything like that. But after hitting the ground, I'm like, this ain't right. Something's going on.
I will interject here. He had a spinal fusion. He worked for the railroad for many years. He had a back fusion, and he used to say that he felt like there was a blood pressure cuff that was strapped around his thigh, and he used to call his foot the ice foot. And I'd say, well, what do you mean the ice foot? And he goes, I go, is it cold? And he goes, well, it feels really cold. He goes, but I would feel it, and it didn't really, to me, it didn't feel cold.
Yeah. To actually touch it, it didn't feel cold, but to me, it felt like it was in a bucket of ice.
So we thought, well, this has got to be from the back surgery. This is just a result of him trying to, heal from the back surgery. So no correlation between what.
With the whole back surgery, I always thought it had nothing to do with my back. I always thought it was my leg to begin with. And then it turned out to be the back needing to be fused, and then this whole deal with the P.A.D.
So you went from relatively little symptoms to obviously some severe issues with the cramping to then in the hospital having toes amputated, procedures. At what point were the alarm bells going off in either of your heads thinking, is this normal, or what's my end game here? Am I going to lose my leg? Were you thinking that?
Right as they were cutting toes off, I thought for sure that the foot was going to be next, but
we were pretty impressed with the wound care doctor.
Yeah.
The wound care doctor ended up getting involved after there was osteomyelitis in one of the bones, and they pretty much they did a surgery on Derrick where it basically looked like he had a shotgun blast through the foot. It was completely gone. and this wound care doctor got involved, and she put on a pig bladder stem cell, which regrew this foot back. So at that point, I was not thinking amputation of legs and all that. We didn't know anything about the disease, was never named. But I will tell you that, we were optimistic that, oh, okay, there's things that they can do. They can actually regrow meat, you know. What really concerned me was sitting in the vascular surgeon's office one day and seeing several of the people being pushed through the door, missing feet and legs. And I remember sitting in the waiting room, and I was just starting to cry inside, because I thought, that's when the light hit me. Oh my God, this is the next step from this, whatever's going on, this is the next step, is these people are coming in without limbs.
So you kind of, if I heard the story correctly from Kim, you became the quarterback of your care and said, we're not going to go this route. We're going to start looking for other treatment options. Is that right?
Exactly. Yeah. Once the disease was named, I started looking it up online. I joined. In fact, I laughed with Kim the other day, because I told her, I said, how many Facebook groups are dedicated to peripheral artery disease? Because what are the coincidences that I found you? I found Kim, and we've been on this journey with Kim and Dr. Mustafa this whole time. So yeah, I mean, I don't know, had we found another group, if they would have been as aggressive as Kim was, and as knowledgeable and connected with so many doctors like yourself that have made a huge difference in our life,
It's one of those, peripheral arterial disease affects almost 200 million people, yet it doesn't really have a face. It's not, I don't think any disease is sexy, but it just doesn't get any press. And it's movements like Kim's, and hopefully part of this podcast. Just our goals are to hear testimonials from you guys who have gone to places where they can help save the legs, save the toes, save the piggies, so to speak, and share that information with other patients who are in similar situations. Because I think a lot of times there's despair, there's depression, I'm listening to my doctor, he or she is telling me I'm going to lose my leg. I don't know what to do. So I guess I just lose my leg, which we all don't, none of us feel like that's acceptable, and neither do you guys. So now you've had some procedures with Dr. Mustafa, and how many piggies do we have left?
Altogether, let's see, 6.
6 left.
4 on the left and 2 on the right.
But you've got your forefoot, you've got your leg, you're walking, you're rehabbing. So yep. That's it's a heck of a lot better than the alternative.
Yeah, you ain't kidding.
Yeah.
Oftentimes the biggest coach here is your podiatrist or the wound care physician. Just briefly tell me how big of a role they played with respect to keeping the piggies and saving the piggies.
Well, they need to be in on it too, because they all got to work together here. Because if you do just the one, okay, yeah, that's fine, get it revascularized and everything. But then if you don't keep going to your podiatrist to check things out, what's the point,
Yeah.
I mean, that's what I'm doing. I'm between, I was just at Mustafa's just not too long ago, and then, working with my podiatrist, trying to make things, debride it, get it cleaned up, so things start healing and closing back up like they're supposed to.
Yeah, it's a long process, but they play a huge role, and they're integral too. So it's important to find a podiatrist that specializes in wound care to really help you out.
And we're so grateful to doctors like you, really, that I can tell you, I've been a huge advocate, not only of helping Derrick, but whenever I see a need somewhere, I belong to a diabetes website. I belong to some different areas where I see people talking about claudication. They don't say that. They say, oh, is this normal? These purple toes, is this normal? My foot to be cold? And I reach out to them, and I let them know that there are doctors that are specialized in treating these types of conditions. And I've got to tell you, it's very easy to go in there and think, well, this is a huge hospital, and it's very easy to get blinded by the marketing that they do to create an illusion that they are the best. And although they may be the best at some of the things that they do, but they are not trained to do these types of specialized surgeries that you guys are doing. But yet it's very easy to go in there and think, well, this is a huge hospital and they're known all over and I see their commercials. It's very easy to get blinded by that. And so you begin to trust what they tell you because you think to yourself, this is what I thought. I thought when Kim told me about Dr. Mustafa, I thought, well, I don't even know you that good, one. And number two, I'm already at the best hospital. How could you offer me anything better?
I think it's important, and this is part of the push too. We as physicians sometimes act like the coach and quarterback for you as the patient, and perhaps we're better coaches and leave you guys to be the quarterbacks of your care to some degree and help. You've got to dictate where that care path is going to go. I wanted to ask you one last question, Derrick. You've mentioned you have diabetes, correct?
Yeah, type 2.
What, I guess, now that you've gone through this process, how have you changed your lifestyle to kind of reduce the risk of this happening again? Because this is a progressive disease. We don't cure this disease. We need to be very aggressive to help reduce the risk. What can you share with our listeners that you've changed with respect to your lifestyle?
Well, first of all, if they smoke, you better quit, immediately. I mean, when this first started in 2018, scared the hell out of me until those were gone. I've changed my diet, of course, all that's totally changed. I try not to, eat a whole lot of crap, but sometimes we do, but we're doing a lot better at that. I know, like with right now, I still have an ulcer on my right foot, which I'm dealing with that now. That's slowly on the mend, and that's just from keeping it clean, keeping the wound pad changed, everything. You just got to change everything with your lifestyle. I mean, from what you eat to what you're doing, you got to.
We've been making carrot dogs. So he has a carrot dog. We're trying to get rid of the meat. We made some bean hamburgers to try to keep him thinking that he's still eating the same way. And then right now he has a wound, but I got him a mini trampoline to do some bouncing and keep the blood flowing. And so we're
That's awesome. That's awesome. I mean, you guys, but I think what also that I've learned with your story is two heads and two folks that are really working together to try to save the toes and save the legs, such as you, Derrick, and you, Toni, I think can move mountains a lot easier than an individual person. And that's something that we see. We really struggle, or at least I do in my practice, individual people who don't have a lot of family support kind of going down the drain, so to speak, with respect to their disease process and really, really struggling. That's a fantastic story. I've got to ask you though, I'm from Wisconsin. Are you guys Bears fans or?
Yeah, Bears.
Well, yeah, I'm more into the whole automotive thing.
All right. I like that because I didn't want you. I'm drinking out of my Packer mug here. So, you guys, fantastic story. Thank you so much for spending 10, 15 minutes with us. I hope our listeners find it as enjoyable as I did. I'm going to leave you guys with the last word.
I got to say one thing, Dr. John, and I'm sorry, I had to get this in. I told Derrick before we went and saw Dr. Mustafa, I said, Dr. Mustafa is an expert in this field, and he's working hard, like you, Dr. John, to save people's legs, to save their limbs, to save their mental state of mind, because it does affect you mentally. No one ever talks about that, but it's a huge mental thing when you replay the thought of losing your legs and how your life is going to change. I told Derrick, I said, these doctors are saving legs, and we have a responsibility to make sure that we do everything to be along, to help you help us. So
that's a great way to finish this, because it's a group effort. It's a team effort. It takes a village to really do this, and we play a small role in doing that with respect to revascularization. But if the patient doesn't buy into it, it's really tough. And you guys have certainly bought into it, and a heck of a story. Thanks so much for spending a little bit of time with us.
Thanks, you,
All
Dr.
right.
John.
Thank you,
very
Doc.
much.
Thank you guys. Take care.